Welcome to SeniorFlix. Today we are doing a segment on dementia and Alzheimer's, and I have a very special guest here with me. She's a public education coordinator at Alzheimer's Society of Toronto, and we're so privileged to have her here as we're going to dive into her wealth of knowledge and wisdom on this topic. And I know there's so many questions that we have on dementia and Alzheimer's, and hopefully there will be some of them maybe demystified today. So welcome, Laura. It's lovely to have you here. Thank you so much for taking time to be with us. We have lots of questions on this topic and would love to gain some perspective and knowledge from you.
Yep, I've been really looking forward to this. It's my privilege and pleasure to be here. Thank you.
Wonderful. So Laura, dementia is becoming such a common word these days. I work as a chaplain at the Shepherd Lodge, where it's a nursing home, and we have more than 60% of our residents have been diagnosed with dementia. And it's becoming more and more common. Would you just shed some light on what is dementia?
Absolutely. It does feel like it's becoming more common, and there's a reason for that. So dementia is the umbrella term, and under the umbrella is the types of dementia. So the two most common forms of dementia are Alzheimer's disease, and I'm sure you've heard of Alzheimer's disease. That's about 60 to 80% of all cases. And then the second most common is vascular dementia, and that's where someone has a small stroke, or you may have heard of the word TIA, transischemic attack. And so what we're seeing is that actually vascular dementia is on the decrease because of our knowledge now about healthy eating, healthy lifestyle choices, increasing our activity and our exercise. So that might stop those little strokes from happening. But Alzheimer's disease is on the increase, which I think you've noticed. And the reason for that is because we're an aging society. People are living longer. And so your chances of getting Alzheimer's disease before 85 are 1 in 10, and over 85 are 1 in 3.
1 in 3.
Quite significant, yes.
Very significant. So as you were sharing that, I just had a question. You were talking about the two different types of dementia, the vascular one. Vascular is on the decline. Is it because it's reversible or?
No, it's because it's more preventable, right? Through diet and exercise and active living and volunteering and keeping our brains healthy, doing those word games, Wordle, all those things that we like to do, and really challenging our brains, you can limit your chances of getting it.
Very, very insightful. So how do you know if dementia and Alzheimer's common symptoms, like how do you distinguish the symptoms between the two?
Not necessarily different between those two. There's other types of dementia that are not as common, about 2 to 5%. That's Lewy body dementia and frontal temporal dementia.
Tell me more about them.
So the Lewy body dementia and frontal temporal are often seen in men and under the age of 65.
Interesting.
And so young onset dementia is often Lewy body or frontal temporal. The common symptoms, initial symptoms of those two are mood and behavior changes. And the common symptom with Alzheimer's disease and vascular dementia is memory loss. And it's not to say that we don't see that in both of them or all of them, but that's the most common. And then there's things like misplacing things, the inability to perform familiar tasks, things that we take for granted, like frying an egg, becomes quite complicated. And so that's where we start to see that people need help with activities of daily living.
So these are the few things that you can start picking on that it might be the Alzheimer's.
Yes, absolutely.
Can you tell us a bit more about some of the other symptoms or to look for in early onset?
So repeating things or having challenges with finding the right word, or maybe misplacing one word for another, or sometimes we see what's called a word salad, where all the words are jumbled together like a salad, and you try to figure out what they're actually trying to say. poor judgment or lack of insight into some choices that they might make. So I had a neighbor who used to dress in a house dress and slippers in the middle of winter. So some of those judgment changes. And then abstract thinking. So numbers don't really have meaning anymore. And then when we're communicating with them, because the abstract thinking might be deteriorating, we want to avoid jargon or jokes like it's raining cats and dogs. They could take that quite literally. So there's probably 10 to 12 distinct changes that we see with a person.
So Laura, these changes, are they happening right in the early onset, or is by this time the disease has progressed quite further along?
That's a really good question. So oftentimes those are the initial symptoms that we see, and they do progress. And so we may see one or more of those symptoms in the beginning, and then we may see all of them in the later stages.
So Laura, help us understand this. Sometimes we associate forgetting a word as just normal part of aging, getting older, and or lack of sleep, tiredness. So how would you distinguish between the two?
Okay, so oftentimes people think that memory loss is part of normal aging, and it's actually not part of normal aging. So I work with many different cultural groups, and I've come to understand that for them there's not necessarily a word like dementia, because they believe that it's just part of, oh, my mom's getting older, right? But when it affects your day-to-day life, when you're really not functioning as well as you should be, then we want to look at it and see if it is in fact dementia.
I wanted to touch on the part that you were mentioning earlier about how if you're tired, the next day you'll be fine.
Right. So being tired, we know can affect body, mind, spirit. It can be so devastating and overwhelming for people if you have chronic inability to get a good night's sleep. That's one of the things that we suggest to keep our brains healthy and to avoid getting, sometimes it looks like we have dementia, but once we rule out the fact that it's not dementia, then that's how we actually get a diagnosis, Tansing, is ruling out that it's not other things that can look like dementia, such as being tired, malnutrition, and depression. Those are things, a few of the things that are very treatable, and once you treat them, the symptoms go away.
Laura, thank you so much. We're going to continue this conversation in our next series. So please tune in for some more information and knowledge on dementia and Alzheimer's. Thank you.